Hello, my name is Elizabeth Miller, and I will be talking about childhood vaccinations today. USA Today website reports Catherine Reifenberg, a mother of a 9-week-old baby, Brody Accolade, contracted whooping cough, which is an illness that killed baby Brody and left his body unrecognizable to the family. The family later learned this is a vaccine-preventable disease, and had the mother just received booster shots during her pregnancy, it probably would have saved their baby's life. Children should be vaccinated because history, science, and research all prove that vaccinations are the most effective way to reduce death and generation-altering diseases. I'll be discussing the history of vaccinations, the science behind the vaccines themselves and their irrefutable medical benefits, and the research that's being done to make sure that vaccines are safer. If there's any questions, I'll be able to answer them toward the end of the speech. For centuries, humanity has been searching for ways to eradicate disease, yet now we are looking for justifications for theories that are unproven to not vaccinate our children. As a result, parents are choosing not to vaccinate their children, which is causing fatal and debilitating diseases that were once eradicated to now reawaken. The controversy over these issues is going to lead to preventable childhood deaths. While this controversy is still on a small scale now, with media influence and the uneducated parents that are spreading these rumors, it could cause a much larger problem that could end up affecting the general populace. Science has proven that not vaccinating causes these diseases to become rampant and cause devastating death rates. Journalist Kathy Koch, writer for the Washington Post, wrote an article called Vaccine Controversies. She uses a statistic from the CDC. It showed that when vaccine rates drop, morbidity rates do rise. Her example specifically is based out of the Soviet Union in the early 1990s. In 1989, there was diphtheria out as few as 839 cases reported of diphtheria. However, vaccine rates dropped, and in 1994, it skyrocketed to 50,000 cases that were reported of diphtheria outbreak. 1,700 deaths occurred from that 50,000. So in my graph here, you can see 839 in 1989. It was very low, and then you see this giant jump to 50,000. And again, that's because people weren't vaccinating their children. Science. So facts such as these show that if you can just vaccinate your child, these diseases won't come around, despite the controversies over their potential negative effects. However, none of these have been proven. A growing number of parents are refusing to vaccinate their children because they believe it might cause autism or other chronic illnesses. The public health website reports, though, that this isn't true at all. In fact, there was this widespread fear that came about because of the surgeon Andrew Wakefield. He reported that the MMR vaccine, which is measles, mumps, and rubella, caused autism in British children. It's since been discredited because there were procedural errors, conflicts of interest, and ethical violations in the study that he had published. The solution is simple. We vaccinate ourselves. What happens specifically with these vaccinations is that there are viral and bacterial antigens. There are markers in these that we inject into our body via the vaccine. Then when our body has the markers in there, we can create antibodies to identify these diseases so that when we do come in contact with the diseases themselves, our body already has a way to fight them off, making them less devastating and less likely to spread disease. So it's simple. Vaccinate. It will make you less vulnerable to all these illnesses. The Center for Disease Control, the CDC, states that, their website states that the benefits of vaccines far outweigh the risks. As science continues to advance, there are safer vaccinations, and we're also looking for ways to improve the delivery of these vaccinations as well. This shows parents that the medical field takes this very seriously. It's not something they're ignoring. They're finding ways to make things safer and, illnesses occurring from these vaccinations less likely. According to the vaccines.gov website, the 5 important reasons to vaccinate your child are: you can save a child's life, they're safe and effective, you can protect those you care about, it will cost your family less time and money because you won't be in the hospital spending money on all the medical bills and spending all your time in the hospital trying to fight for your child's life. And at the very most, you're going to be protecting future generations, which I think is very important. In a perfect world, vaccines would never cause any harm. All children would be able to be vaccinated. That's not always possible, though. And currently, like all medical procedures, you take a risk when you get a medical procedure done. Well, when you get a vaccine, you're taking a risk as well. There's always going to be side effects from medicine you take, side effects from a surgery that you have. And the same goes with vaccines. There could always be possible side effects. But know that no vaccine is given without careful consideration first, just like any procedure. The public health website reports vaccines don't just work on an individual level. They protect entire populations. Once enough people are immunized, what happens is that it's a herd immunity. It makes it so that the disease cannot get into our communities because all these people are immune to it, so that people who are not able to be vaccinated, they can, kind of live off our immunity. So what happens is people have certain autoimmune diseases and stuff which make it so that they cannot get vaccinated. So they're protected from us being vaccinated. According to Vaccines Weekly, April 15th, 2015, the article titled, "Georgia Department of Public Health, Protect the Ones Who Cannot Protect Themselves of Public Health." The United States themselves, we have the safest and most effective vaccine supply currently. Healthcare professionals don't give any vaccine without careful review. They also state that the disease-preventing benefits of vaccines are much greater than the possible side effects for most children. So if all our little ones can get vaccinated and live their lives without going through these trouble illnesses, vaccinations are the greatest way to protect those that you love. So does anyone have any questions after hearing all this?
I do have a question.
Okay.
What kinds of vaccines should adults have then to help protect children?
Like the example in the beginning, the mother that could have gotten a booster shot for whooping cough, that's recommended. Just make sure that as a parent, you're also up to date on your vaccines so your children don't contract anything from you. So that's, the safest thing is to make sure you're up to date as well. So just make sure to vaccinate your child. Make sure you speak with your pediatrician and that you and your child are both up to date on your vaccines. Help prevent one of the most dreaded childhood illnesses that could possibly happen to your child and prevent these epidemics from happening. And hopefully we won't have to worry about any diseases we might once again have to eradicate. Thank you.